Hello, my name is Julie Hebert. I'm here to go over the City of Liberty 24-25 Employee Benefits Guide information. We're going to go through all of your health benefits for this year, talk about your cost, how to enroll on Ease HR, and hopefully answer some of your questions that you might have. This year, the City of Liberty is pleased to continue to offer excellent benefits. They're going to continue to pay 100% of the employee's life, medical, dental, and vision coverage, and a percentage of the medical, dental, and vision coverage for your dependents. The pricing is listed there. You can enroll as medical only, dental only, vision only, or any combination of those products. The price is going to stay the same this year, so that is good news. In these days of inflation, things staying the same is a welcome thing to see. Your open enrollment is going on right now during the month of September. We need to make sure we have all the changes done as quickly as possible. We are changing all the carriers to United Healthcare and to Mutual of Omaha, so we need to try to get your enrollment done as quickly as possible. Everything has to be completed by October 1st, and your new benefits will begin on October 1st. If anytime after during the year, if you have a special enrollment event that occurs, such as maybe you have a baby, maybe you don't cover your spouse or your children right now, but your spouse loses his job and you need to add that person, any of those would be considered as a life event. You would have 30 days to let us know, and we can get them added and make that change for you. But you'll have to let Jody or I know about the change so we can get that taken care of as soon as possible. If you are new, you have coverage beginning the first of the month following 60 days if you're a full-time employee. So this year, the medical insurance is going to be through United Healthcare, and this is new. So we previously last year been with Blue Cross Blue Shield. This is a very similar plan. United Healthcare does have a very broad network. This is also going to be a PPO plan, so you will not be required to have any kind of primary care physician designated or any kind of pre-approval needed before you go see a specialist. So that's good news. You will continue to have a $3,000 deductible per person. One thing that's changing is previously with Blue Cross Blue Shield, a family had a maximum deductible of $9,000. This year you'll have a $6,000 max for the family. So that's good news if you have multiple people covered under your plan. That lowered your total deductible. You're also your maximum out of pocket, which means that maybe you're sick, you're in the hospital, you have a lot of medications that you take, you spend a lot of money out of pocket. The most that you'll spend on this plan is $7,150 per person or $14,300 for your family. This is also going down a little bit over what your Blue Cross Blue Shield maximum out of pocket was previously $8,150 and $16,300. Your urgent care copay is going down to $25. It was previously $75. The emergency room copay was $500. Now it's going down to $300. Your primary care type physician copay is going from $35 to $10. And then the specialist, depending on if it's a preferred specialist for United Healthcare or not, it could be as low as 40. If it's a non-preferred specialist, it would be 80. So I will encourage you to find a provider, a specialist that is considered to be one of their preferred specialists, because it will lower your copay from 70 to 40. One thing that is different, if you go to the doctor and they ask you to do an x-ray or blood work, there will be a $40 copay. Previously, that had been included in your $30 copay, $35 copay, but now that will be an additional $40 copay. So that's something new to kind of be aware of. Your complex imaging, such as CT scans, PET scans, will be a flat $500 copay. Previously, they were subject to your deductible, so you could have to spend much more. Now it's just a flat $500 copay. Then the prescription drug plan is also different. They have a $20 tier 1 drug copay, 45 and 80 being the most, where previously we had between a $0 copay all the way up to a $250 copay. So these plan provisions are different. I encourage you to get familiar with what you have with United Healthcare. I'm going to show you some places that you can get some more information from United Healthcare that maybe will help you understand that your benefits a little bit better. As I mentioned before, here's some information on the network. Since we are changing, here's how to find a provider. You can also get an app. We'll go over that at the end. I encourage you to get enrolled with My UHC. Give us about 2 weeks before that'll be ready. before the end of September, that will be ready for you to enroll and get on the My United Healthcare app, and you can find providers, you can get a digital ID card, and lots more information there. So the dental, vision, and life insurance and all the other benefits are moving to Mutual of Omaha. Mutual of Omaha has a very wide network as similar to Principal. With the dental insurance, you will continue to offer the same benefits. So if you go to an in-network dentist, all your preventative care is covered at 100%. So you can get your teeth cleaned twice a year. You can get x-rays done, and all that's included 100%. If while you're there, they say, uh-oh, looks like you have to have a cavity filled, then that's going to be covered at 80%. You're going to pay 20% after a once a year $50 deductible per person. If it's a major service like a filling or a crown, or having a tooth pulled, it's going to be covered 50-50. You do have a $2,000 annual maximum on your dental plan. And if you have orthodontia for your children, you have a $3,000 lifetime limit, and you can use that 80% all of that in 1 year, but you have $3,000 over the whole year, over their whole lifetime. The vision benefits are available also through Mutual of Omaha. They use the iMed network. So here's some information about calling to get a provider. You can go there or to this link here. You can download the iMed members app and get a digital ID card and all the information that you would need there. To go get your eyes checked is $10. If you want to get new glasses, they're going to give you $150 towards your frames and then 20% off of anything over that. You're going to have a $10 copay to get the lenses, and then you're going to have that allowance towards your frames. So you can get new glasses, the frames every other year, new lenses every year. If you decide you'd rather have contacts instead, you do get $150 towards contacts and 15% off of anything over that. So the City of Liberty will continue to provide to you a life insurance policy that's 2 times your annual salary. It does reduce as you age. It's important that you make sure that your beneficiaries are up to date and ease, as that's what we would use if something were to happen to you. If you stay with the City of Liberty and you retire with them, that life insurance would go away, but they do provide you with a $5,000 term policy that would be in place for you. They also offer $5,000 of life insurance for your spouse and $2,000 for your children, and that's free to you as well. This year, we're adding the option to purchase voluntary short-term disability insurance. So the way this would work is after 15 days of being injured or ill, it would begin to pay 60% of your weekly earnings up to $1,000 per week. It would pay for 7 weeks. And the easiest way to look at that is to look at it in the Ease Online system. You can see the pricing there. Then you are also eligible for voluntary long-term disability, and it would replace 60% of your monthly earnings up to $6,000 per month. Benefits would begin at the later of 90 days or at the end of your short-term disability. So if you have the short term, you still can't go back to work after 7 weeks in the 15-day waiting period, then you would be able to start your long-term disability. And it would actually cover you until your normal Social Security retirement age. Depending on your age when you become disabled, there's a little bit of difference there. But again, these are prices based on your age, so you'll be able to see that in Ease Online. You can also purchase voluntary life insurance. So you get the 2 times your salary, that's free to you from the city. Then you can also purchase an additional coverage through Mutual of Omaha up to $300,000. So your first year eligibility is $150,000 without any medical questions when you first become employed here. You can also cover your spouse and your children. So the information again is going to be available on Ease Online. Critical illness, it helps basically by paying you a lump sum cash benefit if you were diagnosed with a serious illness. And again, we'll go over that in a little bit more detail in just a moment. But that is kind of like you get a cancer diagnosis. If your benefit amount you selected was $5,000, if you get that cancer diagnosis, you're going to receive $5,000 from Mutual of Omaha. And it's your money to do with either help cover expenses, help cover income that's lost during an illness, but it's just your money to use as you need during an illness. The accident insurance pays a lump sum amount directly to the person that's covered when they have a covered injury. So, say your son or daughter is out playing sports and they break a leg, it's going to be a certain payment based on the injury. So, that's available to you. We can go over that in a little bit more detail as well. It is a set price. There's your biweekly deduction amounts for that. Hospital indemnity insurance basically helps pay for out-of-pocket costs while you or a family member is hospitalized. So if you go into the ICU, you receive a payment per day. If you just go into the hospital, you receive a payment per day. And we can go over that in just a little bit too. This is the COBRA notice. So this tells you if you were to leave the city of Liberty, you wanted to continue your health insurance, how much it would cost. This talks a little bit about when you turn 65, if there's some things that you need to do for your health insurance. Okay, so this is how you can go to the myuhc.com app and you can get your digital ID card. You can find a provider, lots of information there. So there's a handout on that. Here's about the dental insurance. So again, there's an app, there's an online website where you can go and get lots of information. You can look at your explanation of benefits, you can find a provider, you can look at your claims, you can get an ID card. So there's some information on that. Here's the same thing for your vision benefits. And I also included some detailed information about the short-term disability insurance and how it works. You can see what your waiting period is, how long it's going to pay, the specific details of that plan. Then also here's some information on the long-term disability and what happens with it. And here's information on the critical illness plan. So the critical illness is you pick a benefit amount and then it's going to make that payment based on what illness you have and what it pays. Then the voluntary accident, this is going to also talk about specifically, like say you visit the emergency room, it's going to pay you $300. If you go to an urgent care, it's going to pay $225. And this doesn't interact with your health insurance. This is a standalone policy that you can purchase. So in this case, if you go to the urgent care, they're going to give you $225. Your copay is only $25 to go to that urgent care. So it's actually going to benefit you to have this program. So this talks a little bit about how all that works and the cost for you. And here's about the hospitalization. So if it's $1,000 per admission to the hospital, you get $2,000 if it's an ICU admission, an additional $100 a day if you go into the hospital. So you can cover yourself and your family members on that plan as well. So when you're in EASE, you can actually, when you're signing up for your benefits, you'll be on this screen and you would select, say, your dental plan. If you want to look at any more information, there's quite a bit there embedded. If you just click those links, it can bring you to these flyers. Everything I have, I try to put in there so that if you want to get more details on what specifically is included, what procedures are covered at what level, all that information is there at your fingertips. And you can always go back into EASE and look at these even when you've completed the enrollment. So we appreciate you guys. If you ever have any questions, one of the most important things to know is that I'm here for you. My email and phone number are on the front of this cover sheet, and I'm happy to answer any questions or be of any assistance that I can. Thank you so much.